Yep, one more time. There we go. Exhale. It's okay. Here we go. Relax. There you go. Good. Very good. Very good. Ooh. Yeah. Turn your head left. Well, yeah, no, see, you wanted to turn your shoulders.
Yeah,
cheater.
okay, I wasn't ready.
Cheater pump meter. Well, no, hold on. That was a test. Because that was like, you did the Larry King.
Wow.
Tell me what's going on. I love that you're a dental student because everything directly translates.
Yeah.
You guys have done a really good job of teaching everybody to, and they have to participate. And I'm trying to work on that as a chiropractic. Everybody's got to participate. Anyway, so shoulder, neck, stiffness. Tell me what's going on.
Yeah, it's probably been like 6 or 7 years that it's really been bugging me for. In high school, I was working out kind of consistently. I don't know if it was related to that, working out like improperly, stuff like that for a while. But once I was in my sophomore year of undergraduate is when I really started to notice pain. The pain originally was on my left side, and then I saw just a general doctor there. I went to the physical therapist place there as well.
Where was the most pain on the left side? One finger especially.
I mean, it's probably just my like upper trap area.
Okay.
I would say.
Okay.
But then so I'm not, I'm right hand dominant. It was easier for me to kind of just like tuck this back into what I felt like a normal position and not really just keep it in a better postural place.
Okay. Yep.
So I feel like a lot of it's just postural, being on a computer, being on a phone, being on, all that stuff.
Okay.
Same old.
And was there something at the gym that you noticed was aggravating it when?
I just felt like I was just a novice working out kind of thing. Just might have doing lateral raises or just going too heavy too quickly, stuff like that. It was never like I had like a pop or anything like that. But then eventually, when I got to a point of a lot of pain, I wasn't able to bench press anymore. I would get some sharpness like right here in my clavicle area, basically.
A couple things going on there. Yeah, when the shoulder goes forward, you're going to jam a lot of the joints and tissue there on the front. The border of the scapula, so when you're saying shoulder, like it was the pain chart,
sure.
The border of the scapula is actually a referral point from the joints in your lower neck will give you pain here.
Yeah. The
care is a couple faceted. One, we want to loosen the upper neck, get the stress off your lower neck, and then teach you some things about orthodontistry type of thing, getting the alignment fixed, because ultimately it's not just about cleaning the teeth, it's about getting the right alignment that we're supposed to be in so that you can clean them.
Yeah.
So, I mean, many people kind of stop there with the, like, chiropractic's going to, 3 times a week clean my spine, but it's really supposed to be, we learn to take care of ourselves. Go ahead and stand up for me. Let me look at your posture here a little bit. All right. Yeah, your left shoulder's high, quite significantly. Right now you're in left avoidance, right abuse. Yeah. So old injury over here. Yeah. And now we're in, you're tilting to your...
One other thing to mention, I had, when I was in high school as well, soccer injury. I went to like clear a soccer ball and this guy came in like, kind of hit my hip like this. And now I have a thing where, sometimes where I'm like laying down and if I were to extend my hip, I get a pop there too. Okay. But yeah.
Okay. Seems some scar tissue in there.
Yeah.
All right, I got you. You're fine. See right there. Okay. Yeah, about an inch. I want you to just turn your head left. Well, yeah, no, see, you wanted to turn your shoulders.
Yeah, okay, I wasn't ready.
Cheater pump meter. Well, no, hold on. That was a test. Because that was like, you did the Larry King.
Wow.
The Larry King, the don't make fun of Larry King ad. All right, because you said that everybody else, he works fine.
Okay. He's ready now.
There you go. Just any pain when you turn left?
No, no pain.
Turn right? Any pain when you turn right?
No.
Okay. Maybe starting back for me.
Okay.
Feet flat. There we go. Cross your arms. All right. Take a deep breath in for me. We'll sit up. Head back for me. Exhale. There we go. Deep breath in. Very good. Head back. Exhale. Very nice. Deep breath in. Head back. Very good. Exhale. Good. Very good. Perfect. Take a deep breath in for me. Exhale. That's it for me. Good. Breathe. Let's go face up for me. Good. Very nice. I have I don't know, 3 or 4 dentists that I come in here actively that I take care of, and They're all phenomenal patients. Have you seen the movie Wild Hogs with John Travolta?
I feel like, it's been a while. But
and Tim Allen.
Yeah.
Okay, so one of my favorite scenes is John Travolta is trying to convince Tim Allen to go on this like kind of cross country, riding a motorcycle with all his buddies.
Okay, yeah.
And Tim Allen's kind of looking at John Travolta like, what are you talking about? I can't just get up and leave. I have patients.
Sure.
I'm a doctor.
Yeah.
And then John Travolta says to him, "You're not a doctor, you're a dentist."
Yeah.
Right?
That comes up.
Right.
Yeah.
So it's okay, because that's something chiropractors get frequently too.
Yeah.
Right?
Yeah.
You're not a doctor, you're a chiropractor. It's like, so even how...
Yeah, we're brothers in that sense. I think everyone just underestimates the training you go through.
Absolutely.
They're
No.
just,
Exactly. Anyway.
most of them are nowhere near going that far in school. So.
Exactly. Anyway, so everything directly translates. Anyway, so, you guys are all entrepreneurs. You have to start your own places, just like chiropractors, versus getting assimilated to the machine.
Yep.
And there we go. You guys teach prevention.
And that's one of the main things I liked about it.
That's what I teach.
Yeah.
Same thing, just for the spine. Here we go, Arnie. There you go. Very nice. There you go. Yeah. The rest of your career, you just learn how to just keep our spine aligned, because I think of abuse being when your body tells you to stop and you have to say, "Shut up, body," and keep doing what you're doing.
Yeah.
Right? So there's using our body, and then there's abusing our body.
Yeah.
Right? And so the difficulty, I have a guy who comes in here, he's a plastic surgeon, he's doing a procedure, he can't just like, "See you later."
Yeah.
Right? He's got to continue plugging away until it's done, and so that's when you reach for 6 Advil, or and that's abuse.
Yep.
Right? When your body's telling you to stop and you have to finish the procedure. And so we want to, we have to do things to counter that. I got you. There you go, relax. A little tighter on that side, yeah. A little tighter. You got work to do over here.
Yeah, I feel that.
Yeah, and a little more knotted up on this side. Right side moved beautifully, left side's a little congested over here. There we go. So ultimately, if the upper neck was, moving properly, it really shouldn't happen. Can't really overstress your lower neck and your shoulder if the upper neck is working properly. So
Sure.
I kind of expected to find, some restriction up here, which is what needs to be cleared. And then as we teach you the neck dent roll, that's what's going to seal it and make it last longer.
I also get some. I don't know if it's not like this high up in my jaw. It's more like here. But I do some like. I kind of have to like show you. Like,
Good.
It's not catching as much when I'm laying down, but when
I
I'm
got
standing
you.
up, I'm more forward. So there's like something's, I don't know if it's a ligament issue or something like that, or just the bones rubbing over each other. But yeah, or I'm just.
When you're swallowing, you can get it to kind of click in here.
I have to take a complete swallow if I were just yeah.
Mainly on the right side.
Yeah, it's only on the right where I get that.
Gosh, I mean.
But it's pretty complex anatomy in there. All those
Yeah,
highlands.
jeez, right,
Yeah,
really
exactly.
up in
So
there.
I don't know, but it feels like it's like going back off of that almost. Like, So.
I mean, you might be able to pop one of them, or contract one of the muscles that attaches to the hyoid, and then you're moving the hyoid around. And
Yeah. I don't know. I overthink it. Yeah.
That's a tough one.
Yeah.
I mean, there's nothing.
That you feel right there.
Well, how about this? There's nothing that surgically anybody does. So, there's no stenosis. There's no nerve impingements that happen in here.
Sure.
So,
Yeah.
I'm not. There's nothing that there is a lot of just generalized tension in your neck that I think. So a lot of the muscles in the front part of your neck, SCM, the scalenes here, get tense because of the wrong alignment. So I'd be curious just to see how much that changes just by getting your neck
back, yeah.
right in the position, and then as the muscles lengthen, right, a lot of this is all
Sure.
bound up because your head's usually looking down more than it is looking back, and so, I'd be curious to see how much that evolves. Maybe this old, you're saying you played soccer for a number of years?
Yeah, all through when I was younger, up to high school age. And a little bit in college, I guess, too.
So then we're talking headers, right?
Yeah. Oh, yeah.
So do we really want to go into what did you do to this neck?
Yeah.
Right? Who knows what whiplashes or scar tissue that's,
Yeah, I don't get it all when my neck is right here. Like, I can't make my...
Correct. Because it's in the right position. You have to kind of take it to the wrong position to get it to click.
Correct.
Right. Yeah, it's... I want your neck back. There we go. A little bit more. There we go. Good enough.
Then I'll do things like stretch or whatever, and then I'm a side sleep, so sometimes I'll stretch all day or I'll stretch, and I get to a point where it feels like I'm in an all right place, and I wake up the next morning just...
Are you always on your right side when you're sleeping?
Comfortably is more on the right side.
Yeah. We gotta get you on the left.
Yeah. I go back and forth. It's like 50... I mean, I probably like 60, 40, 70, 30.
Okay.
Yeah.
Yeah, we want to get you over to the left a little bit more. Chin up. Here, a little bit.
Who are the people that made this tool? Who made this tool? Like what country or what culture?
Gosh, it all comes from China. The gua sha used to be these are smooth rocks. It's not so much the tools; it is the combing action. It's kind of like a squeegee versus my hand. Like if your car's wet and use your hand to try to get the water off versus a squeegee, the squeegee works infinitely better. at like laying flat with the paint. It's like a squeegee, but for the muscles. You're combing out all the gristle and the grime that's in there, and it's different than massage. Yeah. Oh boy. Woo. There we go. Yeah, you gotta get all that out of there. Front part of your AC joint there, just all the AC joints definitely been jammed up too much.
Yeah.
But not too much around. I mean, deltoid's pretty good, biceps pretty good. I don't have too much. Little bits here and there, but not, most amount of plaque is right.
Yeah.
Right in there, it came out real strong. The pec's not too bad. A little bit there, but. I've combed you evenly everywhere. It's just real dark. Right on that one spot. It's like the mark comes out where there's something internally. It's like cleaning plaque off people's teeth. Sure. You can't create plaque. It's either there or it's not there. I only pick off whatever's present, and that's what the... Let that stretch a little bit. Yeah, let it stretch.
Where are you? I was going to say, where are you from?
Pretty much my whole life been from here. I was going to ask you where you want to practice.
I think I want to go out towards the Rockies for a while. I love skiing.
Cool, okay.
So maybe that for a few years, and then most of my family's down here, so I'm coming back here, I would assume.
Okay.
Yeah.
There's definitely more acidity on this side, even though like I said, the right, you said is the more symptomatic side now?
Yeah, but I do more like work over here. I do more massage or more like stretching and kind of stuff over there, so... I've probably neglected that side.
Like this is more clogged, actually, I would say, more than even the right side. Okay. All this has to be lengthened out. Yeah. Good. I mean, this is real popped up right here. This is gonna throw the work to the right side, but we want to get this leveled out. Have any practitioner taken note of this right here before? Not so much.
I don't think so.
Okay, well, this was a best. These are the roots of your neck. They all get pulled on the more the head cranes down. It just so at the end of the day, we're going to show you some stuff at the end, just to right here, arch back, start counter stretching you. Yeah. Right here is going to be the kind of the peak of Mount Everest that we're going to attack.
Yeah. Yeah, I bought the thoracic interval and one of the neck ones as well.
Good.
I just didn't know if I had the right size and stuff.
We'll go over all of it. Yeah, we'll go over it. Yeah.
But I also didn't want to be on it too much because I wanted to make sure I was placing it right.
Yep, we'll go through it all. Yep. All the years I've watched these cars up that circle, I think people still haven't figured out how to navigate it.
Yeah.
Okay. I hear it like 100 times a day. Mm-hmm. It's probably because people are just like, there's too many people around here.
There's too many combination of young and versus old.
Right.
It's just, yeah.
I call this the immeasurables, the things that can't be quantified on a blood test or an MRI or an X-ray.
Sure.
That contribute heavily to pain. And I kind of first got an inkling of this when people would come in with lower back problems, and I would take an X-ray of their neck, and I would see some terrible looking necks with no symptoms.
Yeah.
Right.
Sure.
Now, part of it's avoidance, but part of it is like this soft tissue inflammation that can't be visualized or quantified. Oh yeah. The main thing with the thoracic dental rolls, you always want to have what we call S to I pressure, so downward. So the vertebrae are folding in the right direction. You don't want I to S pressure. So when you make your contact, you're getting a downward tissue pull. So your thoracic dental roll goes from T1 to T6, T7.
Yep.
Here, contact, downward tissue pull, and then you
Okay.
can pretty much place it anywhere in between there. The main key with that is the tissue pull, and then you just increase the depth over time. You can put support blocks underneath it. The goal is to get to that edge and then back off and take it at the highest level of tolerance that you can handle.
Yeah.
Okay. Oh, I didn't know about the butt, Ed. I shouldn't have said anything. I didn't think I said anything in there. Right there, all this is gonna
Yeah, it's definitely tight.
Just a bigger knot right here. Right there. That's
Yeah, the other side seemed all right there. It's pretty tender too. The
Right.
last either, but
right there.
overall, the other side seemed more tender.
Uh-huh.
Yeah.
All right, I got you. Got you great. Okay, breathe. Okay, got it. All right, take a deep breath in for me. Yep, one more time. There we go. Exhale, it's okay. Okay, we relax. Uh-huh. There you go. Good. Very good, very good. You okay?
Yeah.
Good. Put your arms back down for me. There you go. A little bit extra. Yeah, I just had to take into extension to get it, but yeah, I gotta get that all. This is the peak of your. So I had to bend you back a little bit to get that to click in.
Okay.
But we want to hold that now. In a minute, we're gonna stretch. But breathe, I got you. Breathe, I got you. It's okay. It's good. Okay, it's okay. Yeah.
Oh wow, yeah,
This is shoulder blade, especially on this side. You get a lot
definitely.
over there, but that's all just inflammation. They get all out of there. But this is the peak of your slouch. When I look at you on the side,
Okay,
so
right there.
there's areas of more misalignment, areas of less misalignment. We want to target the most.
Yeah.
The idea would be that thoracic dental roll right over the peak of that, most bang for your buck.
Okay. My brother cracks my toes all the time.
Uh-huh. Somebody's been here. Okay.
Yeah.
Uh-huh.
You going good?
Actually, I got you. Ooh.
That was my ankle a bit too.
Yeah. Ooh, nice. You favor, you gotta get off this right foot. See, you have the difference here?
I had an injury to my left, a hairline fracture. on my
Gotcha.
left.
Now you're beating this up. You see the difference?
Yeah,
All these joints are moving.
yeah.
A lot more restriction on your.
Put more weight onto my left foot.
What I'm saying is we need to help this get better,
Yeah.
so we don't need to avoid it. You know,
Okay.
the old injuries to your left foot have made you go to the right, and now it's the drop metatarsals, bunions, plantar fasciitis. All the stuff happens
Yeah.
over here because you're going to be
Yeah.
you're foavoring going to that foot.
Okay, makes sense.
I would.
Yeah, I like that one.
Okay. But is there any tender spot like in here?
I
Nothing
guess that's a little tender.
compared to. I'm trying to mainly compare left to right here
Yeah, my left seems more tender right where your
Right here?
index finger is. Yeah,
versus.
middle finger.
This is what we tell. There's the
Yeah.
ligaments on the outside here. When you inverge and sprain, you're going to rip.
Yeah.
All that's going to. So you want to try to.
Okay.
To me, and you're saying this is what, 8 years ago? How long ago was this?
Sheesh, I mean.
10 years ago.
Yeah, 10.
All
I'd
right,
say
well-
closer to 10.
My point is that now it's time to start digging. You got to start.
Getting in there.
I would put Netflix on or whatever and to start
Yeah.
until you
Mm-hmm.
Just keep working it until there's no soreness. You can't have any
Yeah.
tenderness in there. And adjustments will do it too. Just having adjusted, getting some blood, get some oil in there,
Yeah.
getting it lubricated. Gotcha. Yeah.
It's like the front,
Uh-huh.
whatever, and popping over the head of the femur. Or trochanter.
Mm-hmm. Mm-hmm. You know what happens is the ligament fabric in here has like this keloid,
Okay.
right? It heals with like a thicker piece of tissue, and you have to try to get it to lengthen. And I would, a lot of this is just digging in here and trying to find where it is, trying to find the actual
Yeah.
restriction or whatever's. The stretches are usually good to do for you anyway, or working on this guy. So you take, how different. They feel the same, or
Roughly, it's a little tight, They're
both are just tight. Okay, that's good. That'd be the main.
Yeah.
The main long term is that one hip is easier to externally rotate than the other,
Mm-hmm.
right? And so. A life of sitting student is just going to internally rotate your hips, so you got to work on that external rotation.
Yeah.
Feels a lot tighter on this right one, for sure. Uh-huh.
So good.
Uh-huh.
Seems like it's-
Around the front there.
Yeah.
You right.
Yeah. That's the opposite.
Right. See, you've torn the tissue in here.
Yeah.
See how it's not doing it?
Yeah. Yeah. And that's if I go play soccer and stuff. Just with the people from school. That's the main thing that starts to bother me. Right after, the day, 2 days after,
What I'm saying is that all this is so tight
Yeah.
anyway,
Yeah.
it's keeping a constant pull, that if you can lengthen some of this, it'll stop clicking.
Okay.
Because you got it's already bound up.
Sure.
Like, we should just, I'm just compare, like,
Yeah.
just, try to bring that up, see, just as equally difficult, or what do you think?
I mean, I don't get the feeling up there, but I get it towards the knee, like the lower
Uh-huh.
it feels tight. But yeah,
Uh-huh.
it's good. It's about the same, but
Hmm.
pretty tight. I got it pretty good right here too.
Yeah, I'd be working on both sides, trying to get, there should be no, a lot of tension in
No
there.
tension there.
Yep.
Okay.
Tilt right. Okay, no. Here, there we go. Go ahead and tilt to the right for me. Oh, yours. Okay, all right, everyone.
Yeah, I was curious about this one.
All right, let's see here if we can get me here. Go ahead and tilt to the left. There we go. Relax your head, relax. Now tilt left. No, hold on, move like that side. Oh. Gritty chiropractor.
Mm-hmm.
1 second.
Did it feel like it moved? Or?
No, go ahead and tilt right. Tilt right. There it is, yeah. All right, I felt like I missed out on that one a little bit. Okay.
I want to do this one right.
All right, press this back, back. There you go, good.
That's interesting.
Interesting adjustment there, Dr. Ed, okay. Sure. Press back here. Keep on. Here we go, a little bit. All right, almost there. I got you. There we go, good. Uh-huh. Okay. All right, feels good. All right, how does that feel now? Go ahead and turn your head left. Give that a chance. Yeah, feel looser.
Yeah.
Not turn with your shoulders. Okay.
Yeah, exactly. That's the main thing. Not cheating.
Kind of middle upper neck.
Mm-hmm.
Head back on it. I'll show you the wrong position. The wrong position would be if you were too high.
Mm-hmm.
Your chin is down, kind of idea.
Yep.
You want to have it just enough that your head can go over it,
Okay.
but it's still in the upper neck as high as you can, but your head's still going over it.
Yeah.
and then 20 minutes. It's just
Mhm.
every day, rest of your life. You just
do that.
counter stretch, put
Yeah.
TV on, and
Especially as a dentist.
especially as a
Mhm.
dentist, yeah,
Right.
you're gonna need to, and then eventually what happens is this goes into your pillow, and I'll show you the pillow in a second.
Mm-hmm.
This goes into your pillow, and then really, the end game is just sleep on the pillow,
Yep.
and then
Yeah,
you'll
that's
just
what I want to get to.
you'll just use the thoracic dental roll for 20 minutes a day
Yep.
to keep the chest in, and then you just sleep on the pillow, and that
Okay.
becomes Avengers Endgame.
Mhm.
That's the end game.
Yeah, I want to be able to get to sleeping on my back. That's definitely a goal.
Right. Many times we go away from our back because there's all that inflammation that the
Mhm.
side allows us to antalgia, allows us to get away from it.
Okay.
It hurts to chew on the right side of my mouth, so I'm just chewing on the left now
Mm.
to avoid. It's like, well, you're avoiding. And then to get off this, don't lift your head off. What you'll do, or just in terms of just using your muscles, what I do is I usually use one hand to grab the back of your head, lift your head up, use the other hand to grab the device, and then just kind of like gently lay your head back down.
Okay.
So just lift your head up with one hand without using your neck muscles. Yep.
Yeah.
Lift it up, pull that out, and then lay your head back down. Yeah. Especially after 20 minutes you've done it, it's going to feel a little odd, but perfect.
Yeah.
Right over the peak of that. Kind of even a little bit lower, like right there. It's good. Main thing is now you lay back. And the main trick with this, yep, arms up. I know, yeah,
Just sliding up.
is you're going to get a little bit of a upward slide
Yeah.
while it.
What happens if the bottom of that comes up?
It's fine. It's fine.
Okay.
Now, as long as you got that downward.
Mm-hmm.
Yeah, and then you want to get these arms down too. Yeah, there you go. One of my grievances is sometimes I'll see chiropractors adjusting the opposite way, right? They're going upwards.
Mm-hmm.
It's like, oh, geez. It's like Picard from Star Trek, Picard facepalm. I'm like, oh, what are you doing? Right, you get louder pops
Mm-hmm.
because you're opening the joint,
Okay.
but you'll see a lot of poor adjusting. When I adjusted the ultimate was the bow move, I call it, where I lifted you up. I bent you back,
Mm-hmm.
and then I compressed.
Yeah.
That's closing.
Okay.
I can show you the model. I got all the
Yeah.
facets on full closure. Why do we want that? Because if the joint is closed,
Mhm.
the weight's off the disc. If we can get your facets, if we can get your joints to close, that means we can stretch the anterior longitudinal ligament deeper, right? So one of the reasons why the ALL won't stretch
Okay.
is because the posterior facets won't close.
Mm. Yeah,
Right?
Makes sense.
You can't go, the fluid and inflammation and scar tissue back here won't allow this to actually, so that's why you have to be adjusted.
Mm-hmm.
Because then if you're not adjusted, your stretching is either ineffective or waste of time. Or it's you're really not, or it's actually dangerous because then you're bending too much where you're loose,
Mm-hmm.
right? So people can get hurt because they're over bending where they're
Yep.
where they're loose and not bending enough where they're stiff. So
Yeah.
you got it. So let me show you the neck dental rope. Since you couldn't get your, he's already got all from people that didn't listen to their chiropractors and resold their. You're supposed to use them, not sell them on eBay. All right, kind of the feature of this pillow is that you can open that up,
Okay.
and that allows you to stretch. Now, if you don't want to stretch so deep, you kind of just leave that in.
Yeah.
But if you want to stretch a little bit, you open that up a little bit. Maybe you go to bed like this for a little bit. You wake up, then you just push it back in. So,
And then I saw those, so you can insert that general into.
right, this zipper's open.
Okay.
Well, I would do about 3 to 6 months
I'll
with
lift that first.
just this.
Yeah.
And then once you've mastered the dental roll and it's,
Yeah.
then you can think about inserting it. But the, there we go. There you go. Yeah. Yeah, that's home.
Mm-hmm.
And it just supports you where you're supposed to be and you have to live a long, happy life. When you're talking when you don't have to look them in the eye,
Sure.
don't.
Yeah.
Yes, your job requires, but I'm just saying a secret for your life will be when you don't have to look down at your patient, don't.
Definitely.
Teach them about, all right, well, use mirrors or whatever.
Yeah.
It's all about the rest. It's about tucking this chin. Every time your chin tucks,
Mm-hmm. Flatten.
and so you're going to have to pay that.
Yeah.
You're going to have to counter stretch that. So why do I have to do an hour on this? Because you did 8 hours or 6 hours.
Yeah.
And then the other thing I always think is because it's usually not just forward, but you're also rotated, right?
Yeah, well, I
bit.
specifically have magnification that has 90-degree angles in them, so I
Good.
can sit more
Good.
because I was, thinking forward, basically.
Thank the Lord.
Yeah.
Yes.
So.
Because most of the dentists I see, like they're not only I ask them, show me exactly the posture you're in, and they usually show me like
Yeah.
No, I couldn't do that. I would be out of school already if I.
They're flexed and rotated. So now we're grinding on one side while we're flexed.
Mm-hmm.
And so I'm like, can we go to the other side?
Yeah, but there's still some having to lean over, so I know I'm still a little bit forward, but yeah.
Yeah. There's two costs, right? There's forward and then there's the chin tuck.
Yeah.
If you can just not tuck the chin so much, it'll. Then when you're on your phone, it's all stuff like that.
Yeah.
Just always understanding that it costs something,
Mm-hmm.
and so we just counter stretch. This guy used to get up however you want, but yeah.
Awesome.
Yep, very good. You got it.
Yeah.